Can you tell me where the pain is located?
Right here.
Right there. Can you describe the pain to me?
It's like a constant nagging pain.
Okay. Does it shoot up your leg or down to your foot?
Not really.
Can you rate the pain at 1 out of 10, 1 being no symptoms and 10 being the worst pain?
7.
Okay. We'll do some active range of motion testing just to determine kind of what movements are limited by this injury and kind of will help us determine what it is. So we'll do a couple movements. We'll do plantar flexion and dorsiflexion. So that's along the sagittal plane and the frontal axis. And then we'll do eversion and inversion, which will be in the frontal plane and sagittal axis. So I'll get you to point your toes to your nose. Any pain there?
Yeah.
Has it gone more than
Like an 8.
an 8 now? Okay, so it looks like you have some limited range of motion and dorsiflexion on your affected side. Let's get you to point your toes down towards me or the ground. Good. How is that? Is there any pain?
About that 7.
About the 7?
No work.
Good. It looks like you have nice, even range of motion on plantar flexion. Can you get you to bring your soles inwards? Any pain there?
Still the 7.
Still the 7? Okay, good. It looks like you have some even range of motion and inversion. Can I get you to bring your soles outwards? Okay, now you have a little bit of difference in range of motion in eversion. What's the pain like in this position?
9.
9? Okay, good. What we're going to do is we'll measure kind of what the deficits are on your ranges of motion. I'm going to use a goniometer, and then we'll see what kind of deficit degrees you have. Okay, so I'm going to just palpate your fibular head and use your lateral malleolus and then your head of your fifth, just as some landmarks. Okay, so just try to rest your foot as comfortable as you can and in neutral. So your neutral is about a 115. Can I get you to point your toes towards your nose? So that way. Okay, so it kind of just moved around like 3 degrees. So normal dorsiflexion is 20 degrees, so that's quite a bit of a deficit. I'm going to get you to point your toes towards me. Okay, and now you're currently sitting at 140, so that's about 25 degrees. And normal range of motion for plantar flexion is 50 degrees, so you're about 50% of normal range. And so based on that measurement, and then the fact that you have limited eversion as well, I would probably, my indices of suspicion would most likely be that this injury is a syndesmosis sprain, or also called a high ankle sprain, just because you have the limited dorsiflexion and limited eversion, and your pain is on the dorsal side. Other clinical presentations that it could be is it could be a lateral ankle sprain, but again, with a lateral ankle sprain, you would have limited or pain during plantar flexion and more like an inversion, depending on the nature of the injury. And your pain would most likely be located below the lateral malleolus, and there might be swelling around the capsule here. It could also be a medial ankle sprain. It does kind of have the same limited ranges of motion with pain with eversion and pain with dorsiflexion. However, since your pain is located more on the dorsal side, so on top of your foot, medial ankle sprains usually have pain on the medial side of your foot and below the medial malleolus. You would also have some swelling in the medial joint capsule here.